Hi everyone, my name is Dr. Lauren Collins and I'm a physical therapist. I specialize in pelvic health and chronic pain issues. So today I want to talk a little bit about how to get some relief to trigger points or those painful areas in your body that when you press on them, like the knots in your muscles that cause pain right underneath them, or they may sometimes refer the pain to another area of your body. For instance, for certain trigger points, if you press on a certain muscle in your bottom, it may refer the pain down into your leg a little bit more, or up into your back. And when I say that, I don't mean radicular kinds of pain, which are different. That's nerve pain. I'm talking about muscle pain, okay? So that's what we're going to talk about here with the trigger points, and we're going to learn how to help them release with a foam roll. Today I'm going to talk mostly about the legs and just do a few of them. So the first one we're going to talk about is the piriformis muscle. Okay, so to start with the piriformis muscle, which again is that muscle in your bottom, first you need to sit on your foam roller, okay? And please bear with me because I am not super duper flexible, but we're going to try and make this work. And you're going to kind of lean onto your hand, and you're going to cross your leg over. And you're going to come onto your side a little bit until you find that spot that's a little tender right towards the outside of your bottom. That is where your piriformis muscle is. And then once you find that muscle, you're going to hold this point for, I like to say, 90 seconds. Muscles need a certain amount of time to first just kind of feel safe, and then they need time to open up, and then they need time to kind of be able to get the memory of what's going on. So that's why I'm going to have you hold here for that amount of time, and what you should feel is the tension in that muscle decreasing, hopefully by at least 50%. And when that happens, then you can go ahead and go on to the next muscle. So that's the first one, piriformis. Okay, hi everybody again. So the next one we're going to do is the ITB, the iliotibial band. And people hold a lot of tension along here. And as you go along, this is tender for most people, regardless if they have some kind of lower body injury going on. But you want to, again, just kind of roll the foam roller, find where your tender spot is, same thing. Hold that for 90 seconds in that position. And then you can go on to the next spot. Okay, last spot is the inner thigh or your hip adductors, and we're going to work on that with the foam roll. So with that, what you do is you lay on your stomach, you put the roller underneath your leg, and you can roll until you feel where that tender spot is. And once you feel a tender spot, again, same thing. You want to hold that for 90 seconds. And sometimes the spot is closer to your pubic bone, and sometimes the spot is actually closer to where your knee is. So find where that spot is for you, or maybe multiple spots, and say, you can treat multiple spots too, and just hold there. Okay, one last thing I wanted to mention about using the foam roller. I understand that maybe everyone does not have a foam roller at home, but these exercises can still be done without having a foam roller necessarily. If you have a soup can or some kind of canned good, or if you have an old wine bottle or an old glass water bottle, you can just use those things too. You can cover it with a towel, a layered up towel a little bit, so you have a little bit of cushion there, and those can be used the same way as you would use a foam roller. So there's just a tip for at home when you don't necessarily have a foam roller but still need to do some trigger point releases. Okay, be healthy everybody.